decision-making process of our city. We pray for direction which will lead our city to be strong and unified. May we continue the legacy of our founders. May we be granted this day the wisdom to make decisions which will be for the good of our city. We also pray for your special blessing on all those who are working to transform our city and make it a better place to live and work. Amen. We all please salute the flag. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening. Mr. Clerk, could we please call the roll?
Councilman.
Here.
Council Mercia.
Here.
Council Milanazzo.
Here.
Council Rourke.
Here.
Council Samaras.
Here.
Council Belanger.
Here.
Mayor Elliott.
Here.
Council Kennedy.
Here.
Council Leahy.
Here.
It's 9 present.
I'm present. First order of business on the agenda, we have the city clerk. We have the minutes of the city council meeting of February 24th. We also have minutes from the transportation subcommittee of February 24th. Entertain a motion to approve, to accept, and place on file by Council Milanazzo, second by Council Mercia. All those in favor signify by saying aye. And the opposed, motion is carried. Minutes are accepted and placed on file. Next section of the agenda, we have the city auditor. We have a communication regarding the snow and ice report. Questions, or Madam Auditor? Anything in the report? We have you here every week, so this week we'll hear
The
from
only
you.
update I would give to that is out of that, the 800,000 estimated cost outstanding, as of today, 650,000 of that has come in and been paid. So there's still about 150,000 outstanding.
Okay, further questions? Before, Counselor, for the auditor, our manager has a report as well.
Yeah, just for the auditor.
Okay.
Sure. I should have asked this earlier, but I didn't know if, are we allowed to, if we lose money in the parking kiosks, is that allowed to be in this estimate too, as part of cost of,
No.
no?
The
Okay.
the only thing that can go into the snow and ice costs are directly related to the removal of the snow.
Okay, but nothing for lost wages for that? Okay. All right, thank you.
Mr. Manager, on the snow and ice report?
Yes, I'd just like to update the council is, first of all, like in our MEMA request, we will be including lost revenue from the parking chaos. But the good news is that Governor Baker we have learned that Governor Baker is lobbying FEMA to ask them to reimburse municipalities at the rate of 100% for all of the storms during that month period. It's not definite, they're just lobbying on but in anticipation of that, hopefully going through, is we have already met and we have already started formulating the paperwork necessary to seek reimbursement for 100% of all of the storms. So I'll keep you updated. If that could ever happen, that would be huge for the city. So I'll keep you updated on that and what happens with the governor and FEMA.
Thank you, Mr. Manager. Mr. Milanazzo, and then Council Milanazzo.
Thank you,
then
Mr.
Councilor
Mayor. Through you to
Samaras.
the city manager. You mentioned FEMA. I know when there's problems with, flooding, and sometimes they actually do allocate funds to pay businesses for lost income, and I'm just wondering if that's something that the city could look at as well, because obviously we hear from restaurant owners and other business people in the downtown, and it's just been an awful month for them.
Mr. Manager.
Thank you, through you. Yes, interesting. I got an email the other day about that issue, so I'll follow up. We're having a downtown property owners
Thursday,
meeting,
yeah.
and also we'll send it out to the business owners to see if they qualify that. But an email did come across that addresses that issue. I'll follow up on it.
Thank you, Mr. Manager. Thank you.
Thank you, Council Samaras.
Thank you to the city manager. I also wanted to bring that point up, but thank you for considering that. But another question I would ask is, what do you feel, based on your knowledge and working in the State House, this is the type of problem, it's unique. In this country, we've had all kinds of problems, whether it's hurricanes or what have you. What do you feel is our chances of getting something like that? Actually, I mean,
Mr. Manager?
I'm asking you to project something that's very difficult.
If you remember, I think it was probably 2 or 3 years ago, there were some devastating storms up in the north central part of the state. As a matter of fact, they were out for power for weeks. As a matter of fact, it got to the point where we fined the energy people in that part of the Commonwealth for not getting the power back on time. And the legislature did pass a supplemental budget to reimburse those municipalities for the costs that they incurred. So the letter that we have sent to the delegation, I'm sure they'll be following up on seeking the same type of supplemental budget to help out municipalities like Lowell. Whether there's enough money there, obviously, there's issues, but it's certainly a good chance to at least try.
But at least we're in the game.
Oh, absolutely.
Okay, that's important to know.
Absolutely.
Thank you.
Further questions on the snow and ice report? Entertain a motion to approve by Council O'Rourke, seconded by Council Samaras. All those in favor signify by saying aye, and the opposed, the motion is accepted and placed on file. It's not 7 o'clock yet, so we will not move into the public hearings as they were advertised. We'll go into communications from the city manager. We have motion responses. We have motion response A through F. Questions on motion responses? I'm sorry, Councilor Mercia, I need better glasses.
Thank you, Mr. Mayor. We did receive a communication in response to your motion about drug overdoses in the city, and one of the pages was talking about the Greater Lowell Substance Abuse Community Resources, and there's a whole page of information on that: unwanted medication disposal options, outpatient addiction treatment centers, inpatient addiction treatment centers at Tewksbury Hospital, peer support groups, peer-led recovery meetings, and nasal Narcan available to all community members. And it was, if we could put this on the website, I think that's very important for people to view that. That's my message to that one.
Mr. Manager.
I think it was an excellent report that was compiled by Frank Singleton, Health Department, but also by John Chemley from Trinity Ambulance, and they're here this evening. I think they did a great job.
Yes, they did.
And they did it by, it was interesting, they did it by neighborhoods.
It was
But they also
wonderful.
did it by day and hours, the time of day, which what's interesting is how many overdoses are between noontime and 4 o'clock in the afternoon. But I think they did a great job compiling the information, and it's really going to help us out trying to combat this problem. So thank you very much on behalf of the city.
Council Belanger and then Council Leahy, could you take the chair? Council Belanger.
Thank you very much, Mr. Mayor. I do like to reiterate the manager's comments, thanking Commissioner Singleton, the Health Department, and Trinity Ambulance for these revealing statistics, to say the least, that confirm this growing epidemic here in the city of Lowell with drug overdoses. And we're not unique to the situation. It is a situation, an issue that has no boundaries. It's city, it's town, it's rich, and it's poor. And it's everybody's problem, not just the city's problem. So we need to begin outreach as soon as we can. There's a lot of information here to absorb. I did take a good look at it this afternoon. But what I'd like to do is first go over a few statistics, how what's staggering here is from 2013 to 2014, we went from 276 in 2013 to 471 in 2014. So that's about a 60-70% increase. And we've already had a number in the first 2 months of this year that I think beat last year's figure to this point. So it is, a lot of research went into this. It's what we do with it that counts. So what I would like to do, Mr. Vice Chair, is make a motion to refer this motion response to the Substance Abuse Subcommittee for more in-depth discussion, and we can have a bigger discussion and bring in health officials throughout the city and really dig in on this issue as we need to do. So I'll leave that motion on the floor. Thank you very much.
Thank you. So motion by Council Belanger, seconded by Council Kennedy. Mayor Elliott?
Thank you, Mr. Vice Chair. I appreciate the report, Mr. Manager, and I concur that the detail certainly will be able to provide, hopefully be able to provide us as well as public safety officials and health officials how the numbers are alarming. They're a lot higher than I certainly anticipated or expected, not knowing exactly what that number is. But the way that it's broken out, we'll be able to sort of, if possible, focus in on those areas. But I really wanted to ask a question of Trinity Ambulance, if that's okay, Mr. Vice Chair, for this reason. They show up, they're on the scenes. I don't think there's any easy solution to this, but we ask everybody. Do you have any advice? First of all, thank you for coming. Thank you for providing this information. Anyway, we're looking for any ways and means to try to combat this. It's as I've said in the past, it's reached epic proportions. We know that the governor, and it's not just Lowell; it's across the state. The governor is rolling out a plan. When your EMTs show up, I mean, we know how many deaths we have, but how many lives are you saving? Is that data that you have that when you show up, you find, you find people unconscious or dead, quite frankly? And luckily, the Narcan pen. Do you have any advice for us? Number one, how many lives do you save? I think is also important, which will unfortunately further exacerbate this, but. Do your officers, not officers, your EMT have any advice on how we can go about addressing this problem?
Well, it's an interesting question. Before we took a look at the data that you're seeing, I was amazed. I thought it was kids. I thought we should do drug and alcohol abuse programs in the schools. But as you're looking at this information right now, you can see the average age of the opiate overdoses and the drug overdoses in general is around 35 to 38 years old. So the school education isn't going to do it. I think what we need, and I've talked to Councilor Belanger about this regarding some of the subcommittees we're putting together. I think what we need is a subcommittee in the city. We need police, we need fire, we need Lowell General, we need the ambulance service, we need the caregivers, the actual hands-on providers to get together and try to create some kind of a program where this doesn't happen. Some of our doctors, the city has a health professional in Dr. John Drake at Lowell General. He needs to be a part of this. We need to solve this problem.
So when you find and save people, what is the next step? You take them to the hospital, and then your EMTs have to stay there, or what is the next step? They're just released? I mean, is that...
Yeah, the unfortunate thing, Mr. Mayor, is that the EMTs see the patient for probably from start to finish for a half an hour. And we generally, unless they repeat, we never see them again. So the hospital intake people, if it's a terrible situation, then they admit them to a rehab facility somewhere. Unfortunately, the closest rehab facilities are 20, 30, 40, 50, 60 miles away.
Where's that, Mr. Chinley?
John, where are some of these rehab facilities?
Boston.
So in Boston? So when we go to the governor, and the reason why I ask you this question, when we go to the governor and the governor says, how can I help? We need facilities here. It's not
Absolutely.
just saving them, releasing them back out to...
Absolutely.
they're not going to kick this habit on their own. It's something where we need rehab services, knowing who it really is affecting now, and I think that's certainly one of the more poignant points that comes out in this data. It's not just kids. It's not just teenagers that are getting hooked on. It's some of it without question, but the vast proportion of people that come up in this survey are, middle-aged folks.
Yeah, I'm a firm believer, Mr. Mayor, in regionalization. So it's not Lowell that just has this problem.
Right.
It's Haverhill, it's Chelmsford, it's Billerica, it's all around us.
So you're seeing these in all the other communities that you provide
Absolutely, yes.
ambulance services to?
Absolutely, yes.
Pretty much across similar numbers, would you say?
No, Lowell is, and Haverhill are probably our highest.
Okay.
But, because the population. But all the cities and towns are seeing this situation.
And so I just have one more question, because I know there are many other questions. Again, thank you for this information. Is there any way to track when you save somebody's lives and they see and they're released, that you see them again?
I mean, our repeats?
Repeats?
Absolutely.
Any percentage of repeats that we see? That's not data
would
that
be
you
hard
have?
to say.
Okay,
That's hard to say. Can we get you the information
okay,
without violating HIPAA rules? Yes, we can.
right, I see. Okay. Frank, did you have?
Mr. Mayor, one of the points that we have a task force also with the Middlesex DA. This is the most recent map of fatal overdoses, and last year in Middlesex County, there were basically 145 deaths, of which 103 from heroin. But as you can see by the dots, it's not just Lowell, and it's not just the surrounding communities, it's becoming an epidemic. That's why the Baker administration will be going to a meeting next Tuesday, is trying to roll things out. But we've just had some interesting statistical analysis that we're going to improve what we've given to the council at the subcommittee with more detail, including how many people are frequently overdosing, because our experience with the death certificates are they often take 3 or 4 or 5 years before the Russian roulette they're playing by putting something in their arm actually kills them. So they start out with a back injury doing landscaping, they start with maybe Percocet or something similar, and it just goes at a steady downhill curve and finally they die. But we're starting to see younger folks come into play too, but average is in the 40s.
But it seems that we have learned, what we can learn from this is that, the Narcan certainly works, but they're going back out. There's no rehab. There are repeats. So, and the closest rehab centers are in Boston. That's not good for us up here in the Merrimack Valley or in this area. We need services here closer to stop people from repeating and just being released and going back out.
Terry Downs, who's a trustee at Tewksbury Hospital, has told me recently that they could double the capacity of the rehab center at Tewksbury. But it's a state decision, it's a budgeting decision, but there's money also that can be generated, revenue, because of the medical system they provide. So there's a resource that could be increased tremendously. They need some leadership to do it, so he's pushing the administration, the new administration, to actually consider that.
And what about the mental health facility we have here in Lowell?
That's the other one. Once Lowell General gave that psych beds up years ago, that sort of shrunk down to a fairly, I'm not sure how many active beds there are, but it's not anything like it used to be in 2006, and that could be restored as well. So clearly, it's a matter of there's been a shrinkage, and now we have a major epidemic that requires something stronger for a response.
Okay, thank you. Thank you very much for the information. We appreciate all the effort that put into us. This is taking us, I think, a step in the right direction to certainly try to put a stop to these deaths. And clearly, we know where it's happening, but we also know that the facilities that we need to help us, it's not located close. Okay, thank you, Mr. Vice Chair.
Thank you. Council Milonazo.
Thank you, Mr. Vice Mayor. The report that Councilman Marcy suggested puts up on our website is full of very good information, and I noticed that under item number 9, it talked about the Lowell Drug Court opened in 2014. My question is, do we know if the Lowell Drug Court actually does refer, I'll call them clients to, say, Tewksbury State Hospital, to say, they have to go in and have the treatment that they so vitally need and not be sent to Boston or to Brookline? And do they get actually sent to Tewksbury Hospital?
Sure, Mr. Manager.
I think Council Rourke could answer that better than I could.
Okay.
Thank you, Mr. Manager.
Thank you.
This is something that myself and Council Mercier are very much involved in, her with the Sheriff's Department and myself with the District Court. With the Lowell Drug Court established this time last year, unfortunately, it's already at max capacity in a short period of time. And how it works is, once you're accepted into the drug court, it's a mandatory 6-month inpatient stay. So you're not, you're in a facility, it's a locked unit, and you're there for 6 months. It's a 2-year total program. What happens is, once the 6 months is completed, then you start your intensive outpatient treatment. You do that for the next year, calendar year. That brings you to 18 months. At that point in time, you're re-released into the community, whether it's a sober house, a halfway house, the Middlesex Sheriff's Department, the OCC program, which Council Mercer is at, and you're there for the next 6 to 8 months. So it's a very in-depth program, a very intensive program. Those people that complete the 2 years show a 90% rate of staying clean. It's very difficult. It's a change behavior that has to take place. And the number one problem in speaking about this in general is no matter what addiction there is, whether it's heroin, alcohol, or whatnot, you have to want to change. You have to want the help. And that's the problem that I'm sure that Trinity sees, that the fire department sees, the police department sees. You have to want to change the behavior. If it's when Mr. Chenley speaks about seeing repeat offenders, and when the fire department sees repeat offenders, which they do all the time, it's people that are on the brink of dying, and that's not enough for them to kick the habit. So, again, Council Mercer and I see it every day. It's depressing most of the time, but with the program that's put in place now, the drug court program, it does show once the 2.5 years is completed, a 90% success rate. So it's something that we're trying to do at the state level, at the probation department, and at the sheriff's office, to increase the number of people we can take into the program. And unfortunately, every day of the week we're taking more people in, with the ultimate goal to make a dent into the problem. And looking at some of the numbers that were given to us by Mr. Singleton, you see the 18 to 24, 18 to 26, that those numbers are actually low, which leads me to believe that the education that's happening at the school level is working. And hopefully, going forward, those 18 to 24 become 24 to 32, 33 to 45. So hopefully, again, we put a small dent in the problem now for a much larger success in the future.
Thank you, Councilor Rourke. The only other comment I would make is in support of Councilor Belanger's motion, and to see if we could add to the list of people that we would invite to the subcommittee, someone from Tewksbury, from Tewksbury Hospital. Thank you.
Thank you. Councilor Rourke?
Yeah, and just one more point, as the mayor stated earlier, Tewksbury State Hospital does have a transitions program. Anybody, again, that asks for help, that wants to be helped, they can contact the transitions program, and they will take anybody and everybody in. What they do is they go through a detox process, anywhere from 5 to 10 days, and they will place them into a facility that will help them. Insurance is not needed for this. But again, what we're seeing is you have to want the help. You have to ask for the help, and if you do, it is there for you. So thank you, Mr. Vice Chair.
Thank you. Any further discussion on this item?
Yes.
Councilor Kenny, then Councilor Mercy.
Thank you, Mr. Chairman. If I could, Mr. Singleton, the report that you gave us is for a 3-year period, and I guess my question would be, is it the case that there has been a spike in the last couple of years?
Yes.
Or has this always been a big problem and it's just receiving a lot more notoriety now than it was 5, 10 years ago?
It's growing, Counselor. We actually started in 2008, if you look at the death certificate data, and the deaths are steadily grown. But the last, maybe not the last year, the last 3 or 4 months, it's been frightening to see. For example, a couple of weeks ago, as you recall, we had 5 people die on the space of 3 days. If you look at the DA's data, she's showing a rate of overdose deaths, fatal deaths, that are almost twice as great in the first 2 months of this year as the previous 2 months in the previous year. So whatever's going on with heroin, fentanyl, or other things out there in the street, there are definitely, this epidemic is expanding.
And do you have any insight as to why is it spiking? Do you know that, or do you have any?
Well, I think they start with prescription drugs. Often that's because they got injured doing the roofers, people working in the trades. But that's at least a controlled dosage. As that's getting more difficult to abuse, they switch over to heroin. Heroin is a crapshoot. You don't know what's in it. You don't know what it's laced with. And I think that's what's causing a lot of the problem now.
But I guess what I'm thinking is 10 or 15 years ago,
wouldn't the same thing, the same situation exist? In other words, 10 or 15 years ago, wouldn't it still be that you would have prescription drugs and then you would escalate if you had a back problem or something like that?
No, actually, the problem was the medical system about 10 years ago went into something called pain as a vital symptom, vital sign, rather, and now they started prescribing these very powerful artificial opioids to people. I've just had 2 surgical procedures, minor, for skin cancer. In both cases, I was given oxycodone I didn't want or ask for by the prescribing physician, who wanted to make sure I was not uncomfortable when the anesthesia wore off. Basically, Tylenol did the trick. So all of a sudden, they're handing out a lot more of these very powerful drugs that were not marketed or done 20 years ago or 15 years ago. This is a relatively recent development in the medical profession.
So is it your contention then that the reason that there's been a spike in recent years is because physicians are handing out much stronger pain medicine than they were
Yes.
10, 15 years ago?
Which is why the state's developed now the prescription monitoring program, and they're trying to work with doctor shopping and all that, because the source of much of this is someone writing a prescription for a controlled substance is very powerful, and perhaps way more powerful than it's needed for some of the activities. We've had people go to a dentist and come by with a 30-day supply of Percocet for a pulled tooth. To me, that's gross overkill. I mean, we're working now, so is the State Health Department, with the medical system, trying to actually change this whole prescribing practice to reduce the amount of drugs being prescribed. There's a lot. That's why we're doing, for example, we started this, and we have one April 15th, the prescription collection system. We have people coming in with bags of people die of, let's say, cancer in hospice. There's $20,000 because we have police officers there telling me what these are. These are enormous quantities out there. Now, the older people don't necessarily think of it as opioids, but a lot of the kids know exactly what it is, and there's $50 a pill in the street, and that's why this has been a really great program that we're now expanding to get these things out of the medicine cabinet, out of the kitchen table, and into the incinerator where it belongs, but they're being overprescribed.
Right, but I guess I think, that's a good program. And it's good to get insight from people that are bringing the overdose cases to the hospital and even from the hospital personnel. But really, if the problem's going to be addressed, doesn't it have to be addressed by trying to figure out why the spike occurred in the first place, and what do you do to prevent that? And so that would be, at least according to you, that would be the physicians. The physicians
It started there, but the recent spike seems to be a turning more and more to heroin as they can't afford the prescription drug, or it's difficult to abuse. And the heroin is really, according to the police chief, is now 80%, based on state lab analysis, 80% to 85% pure, and now it seems to be laced with other very powerful opioids to make it even stronger. So that's a recent development, that people who were abusing prescription drugs are now turning in large numbers to heroin.
And so do you think that the spike in the problem could be related to the change in insurance coverage?
That I can't say. That's a good question. I think when we have the subcommittee meeting, I believe others should be here at that meeting who would have much better knowledge of that. But I know the Baker administration is trying to roll out a major change in the way things are being done on this, because it is an epidemic that's killing. Like I say, if we had something like meningitis killing 25 people a year in Lowell, there'd be an uproar. But the fact that's what's dying on our death certificate reviews every year, an average of 20 to 25 people.
Thank you. Thank you.
Councilor Mercy?
Thank you, Mr. Vice Mayor. And Frank, don't go too far, because I have a concern, and I'm kind of like, again, thinking out loud, but this council supported the very important motion by Councilor Rourke, and that was to put Narcan nasal spray in public safety vehicles.
That's correct.
And so we approach a person gonna die of an overdose, and let's say they spray the Narcan, but there's the rest of the story. The rest of the story is, so he gets out of it immediately, but he needs to follow that up with medical treatment right away.
That's correct.
And they don't do that, and we can't make them We're violating their constitution. How do we get around that then?
That's why there needs to be some changes. I agree with you. It's very dangerous to have Narcan temporarily reverse the overdose, but the drugs are still circulating, and then you go drive away, if you will, and then they even sometimes take more drugs because they're sober now, and they end up dying of the overdose. So we need to have a way to get them, if they, actually, maybe John, could you talk about refusals in the ambulance company if someone has been received Narcan and doesn't want to go to the hospital, is refusing to be transported?
Yes, Madam Mayor, by law, if they sign a refusal, we don't have to take them. The problem is, and Frank needed to say one more thing, not only do it's not all the time, please, but many times, not only is the addict woken up by the Narcan, but now he's furious.
Right.
Because he came out of his high. Not only is he mad, we drive away, and 2 or 3 hours later, we're back at wherever he lives, picking the same guy up again, because he got high again. So, Councilor Rourke mentioned a minute ago about it has to be a choice, it has to be his own decision, et cetera, et cetera. Mr. Mayor, when you say, what do we do here? How do you make somebody
Yeah, that's right.
make the right decision?
That's
and
the
stop?
question.
I don't know how to do that. I don't know how to do that. Narcan is a miracle drug. It's a wonderful drug.
But
it
it's
also
not the
has-
the
it's not
final
for everybody.
solution, yeah.
Yeah, it's not the solution.
So I'm asking everybody here, how do we go a step further and bring them, I don't know how you do that.
I think a rehab facility closer where they don't have to travel to Boston every day or once or twice a week to get their other medications or whatever. It's hard for them to get how do they get there? Take a taxi, it's gonna cost them $100 each way? I don't know how they get there.
So where would you be bringing them anyway? To the hospital?
Initially,
Right. If we-
from the street,
From the street, where would they? To the hospital?
yes. And then the hospital admits them they'll make a series of calls, and honestly, and John will tell you this, our IT guy, they might sit in the emergency room for a day, 15, 18 hours for a day, trying to locate a bed where this person can go, because there aren't enough beds, and the ones that they do have are full with a waiting list.
There has to be something we could do to get them in that hospital, and even if they refuse, are they not deemed in their right mind or whatever, temporarily, that we could get them there and seek help?
The only way we can transport them to someplace like that is if a police officer says they're going to the hospital, I'll take responsibility.
We arrest people and put them in a cell overnight for protective custody. They don't want to go, but we can do that. Why can't we apply that same principle to this particular situation?
It does happen sometimes.
Protective custody in the hospital for further treatment so that they don't die. I don't know. There's a way we could do it. I'm trying to figure it out, but that's my thinking out loud comments. Thank you.
Thank you. Council Rourke?
Thank you, Mr. Vice Chair. Getting back to Councilor Kenny's question about the reason for a spike over the past number of years. When I started my career in probation, a bag of heroin was $40, $50. As Mr. Singleton was talking earlier about Percocets and OxyContin, an OxyContin 5 is $5, an OxyContin 20 is $20, and OxyContin 30 is $30, and so forth. So, we see it all the time. A bag of heroin, one hit is basically $5. So, what happens is if people buy 4, 5, 6 bags, they do all 4, 5, 6 bags at the same time. With the 80% being pure, and as Mr. Chenley spoke earlier, the mixer with fentanyl, most of the time it leads to an overdose. And if, Lowell 5 doesn't get there, if Trinity Ambulance doesn't get there, that's where you see most of your deaths. I think what we're talking tonight, as Councilor Mercer had stated, it does take a total team approach, with the police, with the fire, with emergency services, most importantly with the city and the state. I know there's legislation now being filed that would force somebody to go to a hospital, hopefully for a 36-hour hold. If someone does OD, that makes them stay at a facility. I've seen it, unfortunately, close to me where someone does overdose, they go to the hospital, and they're gone in, less than 60 minutes. So, and that's unfortunately the norm instead of the exception. So, to Councilor Belanger's motion to put it in front of the subcommittee for substance abuse, I'm all for. I think it's needed. And hopefully, again, we can make some kind of dent into an epic problem. Thank you.
Thank you. Council Samaras?
Thank you. To Mr. Singleton, those patients who have died, do we know what programs that is it possible to find out what programs they have taken or been part of to find out if anything's working? Or, in a sense, if you find that someone died but really never took advantage of a program, that's an issue, that we have to reach out more.
Yes, sir, I think we really need to look at that. In fact, I'm going next Tuesday. They're having a series of listening sessions. The Baker administration of the Mass Department of Public Health is one in Worcester at 4 o'clock. One of the issues we're trying to get at is we need to talk among ourselves a lot more rather than have these stovepipes of here's treatment and here's, emergency management and here's public health. We have to really get together and figure out a holistic approach to this whole problem. There are solutions, but we're not getting them yet.
No, I think you've listed a very important aspect. You also talked about doctors more freely giving out this type of medication. Do you see any way of curtailing this or in some way developing
Actually, yes.
regulations?
The insurers, some of them, like Blue Cross Blue Shield, are now starting to restrict how many actual prescribing of oxy goes on. There's a bill being filed right now that the emergency rooms cannot give more than a 72-hour supply rather than 30-day supplies or the like. There's a lot of oversupply, and like I said, even in my own case for 2 minor medical procedures, I could have had almost a month's supply of oxycodone for something that Tylenol took care of in 2 days. I don't know why the medical system has gone this route, but I think part of it is money. There's obviously a lot at stake here, and I think we've got to change that, and the state is trying to, through the prescription monitoring program, tighten it up, but we're still prescribing way too much. Dentists, we just had a major meeting with the dentist profession, and again, an enormous amount of dentistry is prescribing a large amount of these products. Some people are getting 60 to 90 days. That's not needed. I mean, this is no reason for that. We're going to try to stop that, if not by law, at least by other mechanisms. There's too much stuff on the street.
I think you're absolutely right. I think most of us have gone to the dentist and received that type of medication when Tylenol, or really nothing, just time,
Right.
Could take care of that. There's another issue, a concern has been about the age, but I'm really concerned that I think as time will go on, you're going to see a major spike with our young children, and it's what type of programs do we have in schools. I think, over the past, you've had some good programs, the police have had some good programs, but I think it's an area that has to be stepped
Right.
up because, it's a ladder effect.
Right.
At some point, you're going to see a major spike.
Yes, yes, Councilman.
High school students.
In fact, we're working on a new grant where we have some good hope to get from 12 to 25 that'll be targeted for that age group that we're eligible for among a half a dozen other cities in the state. And one of the issues, we've been in the 4th grade right now doing some curriculum, and those kids absorb this stuff through the culture, the amount of knowledge they have, not that they're using drugs, but the amount of knowledge and terminology and everything else is pretty scary because it's a television and everywhere around us. So by the time you get to high school, that's when you're starting to intervene, that's too late. You've got to start earlier. It's not safe. These drugs are dangerous, but people have the feeling that prescription drugs, they must be safe. Well, I'm sorry, that's not true, but it's a hell of a way to find out about it by ending up in a coffin, so we're trying to stop that.
Just a couple of more questions, but I'd ask the city manager also to look with his people at the possibility of coordination of services. I think what Commissioner Singleton is talking about, maybe Lowell could be a model in that area as to looking into what services out there. And is there a way to coordinate services to people so we'd have even more information and possibly help them? One more question to the city manager, the city solicitor. At last meeting, one of the meetings, I requested, based on the issue of Narcan, that if a policeman or a fire department person administers that and they refuse to go to the hospital after that, is there any way we can force them to? Because, and I would take it even to the ambulance service, EMT, anybody who takes somebody out of a coma because of the use of this, we'll say, miracle drug, can we in any way force them to go to the hospital and receive help. I think that's the only direction we can go in.
Right, at the present, the answer would be no. We can continue to work with the police department, fire, and reach out to Trinity and others to see what steps could be taken, and work with the manager's office as well to explore perhaps a change of legislation.
The thing is, I think what we describe is the patient's right or the person's right. But the thing is, it's obvious that they're in a state of mind that is not, we'll say, rational. So can we use that as part of the, the attempt at making changes?
Again, those types of things could be looked at, but presently, that's not the case.
But do you understand the push?
Yes.
Because, with all the work that's being done by the hospital, by the ambulance service, by the hospitals, by the MTs, by the health department, without some of these basic controls.
Right, it's a tool that doesn't presently exist.
Okay,
Right.
thank you. Thank you.
Thank you.
Mayor Elliott?
Thank you. I will be very brief because this is going to the subcommittee. I think I support it going to the subcommittee because this is a longer conversation. But I just wanted to add that while we're identifying the problem, and it's also the drain on these resources from our police department that could also be better used for the other facet of trying to address this problem, and that is the source. Where is it coming from? So I think it would be helpful, Mr. Manager, if the police chief could come with either the vice squad or the gang unit to find out from, the officers on the street what, it's supply. Supply is as much of the problem as, or is the problem. If there's no supply, then we're not going to have this huge problem. So I think that would be helpful, whether it's, the vice squad. We do know there's at least one or two gangs in the city that, that directly have this organized unit of drug distribution. I'm sure that's, if we can kind of cut it off at the source, then that would also be helpful. So I think that'd be helpful to have the chief there to say, yes, we know that there's a problem with heroin in the city, and this is what we're doing, to combat it. Okay, thank you, Mr. Vice Chair.
Thank you. Council Belanger?
Thank you, Mr. Vice Chair. Lengthy discussion here by my colleagues, but some great enhancements to my motion by Council Milanazzo, Mayor Elliott. But if I could add to this, I'd like the manager to reach out to the Baker administration, who is on the forefront in this issue, and have a representative from the Baker administration there will notify them well in advance, because what's startling to me and what I want state officials to hear is Mr. Chumley's comment is that there's no place for these people to go. They're waiting in emergency rooms, waiting for beds. This is what we want state officials to hear, that this problem is outgrowing us, so to speak. So that would be great, through you, Mr. Vice Chair, to the manager, and make this a well-rounded subcommittee hearing. Thank you very much.
Thank you. If I just might add, too, it goes without saying how much work Representative Golden's done on this issue, so obviously we'd invite the state reps to come, too. Any questions on other items? Mr. Manager, you want to speak on item C?
Yes, thank you, Vice Chairman, Mr. Vice Chairman. Through you, I just
Excuse me, can we have a vote on Councilor Belanger's motion, please?
Oh, okay, sure. Roll call. Okay, so just accept the motion by Councilor Belanger, seconded by Councilor Kennedy, to send this to the subcommittee for substance abuse. All those in favor? Motion passes. Mr. Manager?
Thank you, Mr. Vice Chairman. I did just want to have a comment. Since I started here, we've been working on getting Wi-Fi in downtown Lowell. I think a great tool to attract people to downtown Lowell. I know the report that was submitted to you was about the same length as War and Peace, but I'd ask Marianne, I wanted it in there because I thought it was a great tutorial on what Wi-Fi is, and if Moran Fernandez could just come up and just give a brief explanation of what's going on with Wi-Fi in downtown.
Thank you, Mr. Manager. One of the things I would like to do, it's originally in response to Councilor Rourke's motion. I would like to apologize for the delay in getting a response, but it has been something we've been working on. It is something that's been lengthy. It's something that's taken a lot of work. It's all been done internally by the MIS department. And, essentially what it comes down to is there's a lot of different ways to get Wi-Fi into the city. Many of them are very expensive. There is one that stands out that is of no expense, and that's partnering with someone who already has an established infrastructure in the city and who MIS is recommending through the city manager as a response to the motion, is with Comcast, where Comcast Xfinity already has an established infrastructure in the city. They have well over 600 businesses in the city that are already signed up on their services to offer Wi-Fi. They have several thousand residences throughout the city that are signed up that offer Wi-Fi that everybody in the city can benefit from. And it really just comes down to great news for the city that we have something in place today that many people may not be aware of. And what that means is that if you're visiting the city, if you're in and about the city and you have a device that you want to access Wi-Fi with, whether it's your phone, an iPad, a computer, a laptop, you can typically turn it on and find an Xfinity Wi-Fi signal in and around the downtown area and in many other areas throughout the entire city. And Comcast has come forward to make it a priority to expand that Wi-Fi coverage here in the city of Lowell specifically, to grow it and make it available so that folks, hopefully when you're in and around the city, you could walk into the city downtown, you could sit down somewhere to have dinner and pull out your iPad, which you may not want to if you're having dinner, but you can pull it out, you can pull something up on it, access the Wi-Fi signal, and it is, again, at no cost to the city for anyone who wants to access it. If you're already a Comcast Wi-Fi subscriber, which many people in the city are, then it's free. If you're visiting the city as a college town, if there's students that are in and around the city who have parents coming in, who have family, friends, etc., if they are already Comcast subscribers elsewhere in the Commonwealth, outside of the Commonwealth, anywhere across the country, if they are using Xfinity Wi-Fi, it is available to them for free. If they are not currently subscribers, you can receive a certain amount of service. I think it's 2 30 or 60-minute sessions for free a month. Otherwise, it's like $3 an hour, $7 a day, $20 a week. But I understand that it partially answers your motion, which was for free Wi-Fi. It is free to the city by partnering with Comcast, but from the perspective of providing a service that can be delivered throughout the city, not just in the downtown area, we believe that partnering with Comcast is really just a great opportunity for delivering that service to everyone within the city.
Thank you. Thank you. Mr. Manager?
Thank you, Moran. I thought he did a great job, not only with the report, but leading up to the report, negotiating with Comcast. And as you can see in this report, if you look at the map of downtown, Merrimack Street is full of spots where you can get the Wi-Fi, and that's just going to be expanded as their signal grows. So I think it's great news, and thank you, Mr. Ferrandez, for your work.
Council Rourke?
Thank you, Mr. Vice Chair. I would thank Moran as well. I know we've had many discussions concerning this going back to last year, and I understand the difficulty of getting something like this done. So thank you for your hard work and getting this done. I think it's a huge advantage for an urban city like Lowell to have this opportunity for Wi-Fi. I could just imagine somebody live streaming from the folk festival in July, something like that, to where one signal turns into a bunch more. So once again, Moran, to you and your staff, thank you very much. It's truly an asset for the city, for economic development and for many different ways to promote Lowell. So once again, thank you.
Thank you. Council Milanazo?
Thank you, Mr. Vice Chair. It is a very good report, so again, thank you to Moran. What's our next step? Do we, again, work with the administration to try to carry this recommendation out, or is this report get referred to the Technology Subcommittee for further review? Mr. Manager?
Sure, Mr. Manager.
Yeah, thank you. I think that would be a great idea to refer to the Technology Subcommittee, because we're still in the process of working with Comcast. They have to set up these WAPs, which are just, those are the signals going to send out. So even if, like, a restaurant doesn't have their own Wi-Fi, that signal will be strong enough to come into the establishment and enable you to hook on. So I think if you refer it to the subcommittee, that would be
Is
great.
the maker of the motion okay with that? Okay, I would move then that we refer the report to the Technology Subcommittee. For
So
further
motion
action.
by Counsel Milonazo to refer to the Technology Subcommittee, second by Counsel Rourke. All those in favor? Okay. Any further discussion? Counsel Mercia?
This has not been on the agenda, but in the past, we did question something, so I'd like to suspend the rules and talk about the census form that came in the mail, that, if I could do that and make some comment
So motion
on.
to suspend the rules by Counsel Mercia, second by Counsel Martin.
Thank you.
Oh, sure.
I'd like to comment about the recent piece of mail that the city sent out in the form of a census that, by the way, we encourage every resident to fill out and send it back. Accompanying the census was a fact sheet for landlords, which was very informative of what the responsibilities of the landlords in respect to their rental property. On the other side of that letter was the developmental services, and they put in a list of the common home improvement projects that do require a permit from the city: electrical work, plumbing, including faucets and other fixture replacement, vinyl siding, replacement windows, retaining walls over 4 feet, fences over 6 feet, as well as those home improvement projects that do not require a permit: interior, exterior painting, cleaning or replacing gutters, retaining walls under 4 feet, or fences under 6 feet. Now, having been the one that asked for this information to be included in anything that will be sent out to the public, I was very grateful to see that it came in my mail along with the census form. And I want to publicly applaud the election office and the departmental services for their timely and informative piece of information. And maybe it would be a good idea to put that on the website as well. So I don't know who's responsible for the website, but they're not going to be too happy about me asking all this. Is this you, Moran?
The individual departments actually are all set up to,
Could you just come up to the mic, Moran? Thank you.
my apologies.
Yep.
The website is set up so that all the individual departments actually manage and maintain their own information.
Oh, they do?
Yes, ma'am.
Well, I think it's so crucial that not just we get it, but people, all in the city. I think that's very important. And if I could also suggest that another piece of information go out reminding residents who own dogs that they need to get a license for their animals every year. So if we could, at your roundtable discussion tomorrow, Mr. Manager, if you have that, that would be another crucial piece of mail that should go out. In fact, I thought it should have gone out in December's tax bill, the quarterly tax bill at the end of the year, because you kind of have to renew your license for your animal in January, I think, for the whole year. So I haven't seen that, and people had called to me to bring that up, and I didn't know how to segue it in, so I segued it into that. But this week, we got a lot of information, very, very good, from all the departments. It was just tremendous, so I want to congratulate our city departments. Also, the water bills, the motion that Councilor Vice Mayor and I made was very, very informative from Mr. Gitchia. Very, very informative, and so I wanted to congratulate him as well. We asked so many questions, we get so many answers. I wish I could share everything with the public, but I was very satisfied with it's going to take a while, and people have to wait, and some of them are, want to be waited on, heard right away. I understand that, but there's so much information and so many people that it affected by this overage with the estimated bills that you can only get to so many at a time. So have patience there. I know it's kind of hard, but this week was very good. Thank you so much for letting me say that.
Thank you. And just if I could, from that report, it's good to know that through the report, it only affected about 1%. So, wasn't all that bad, but we are getting to the referrals as they come in, so thank you, Mr. Gishia. Any further discussion? Council, Mayor Elliott?
Thank you, Mr. Vice Chair. This is not relative to any of the motion responses, but before we adopt the motion responses, I wanted to ask for suspension of the rules as well, to question the manager regarding this latest shooting that took place on Sunday morning. Didn't have time to file a motion, but, it's
Sure,
not on the
motion is
agenda, so make a
suspend the
motion.
rules by Mayor Elliott, seconded by Council Belanger.
Thank you. And I know we are all alarmed, Mr. Manager, but the purpose of me suspending the rules and in hope of getting a report from you, I know it's a ongoing investigation, but it seems, I would like to see if we can get a report or an update from the Chief of Police on the status of, I believe it was Council Mercier, who had filed a motion about the gang, reestablishing a gang unit, and by all accounts, I mean, this many gunshots into a house where it seems to be targeted, and I don't want to say too much because I know the police chief and the district attorney are working on it, but we did go in executive session in the past to get an update, so we wouldn't reveal to, to people what the strategy is of the police department in trying to get these drugs and gang leaders off the street. So if at some point in time in the future, sooner rather than later, was this, what are we doing about these, what I thought we're making some progress, or it was quiet, but I know we're still being vigilant, what we're doing about it in the police department.
Sure, Mr. Manager?
I think it's time that we had an executive session. We'd like to update the council on pending litigation. I think at the same time, it would be good to go in to discuss what's going on. Rest assured, for the citizens in our city, is that was not a random act of violence. That was a targeted shooting. The perpetrator knew what he was doing, was going after that victim. It was a terrible thing, but it was not a random act of violence, rest assured. But I think it's about time we had an executive session. I'll set that up with the chief to make sure that he's prepared to address all of those issues.
Okay. And in line with that, I did get a phone call from State Representative Roddy Mom, who had filed legislation on this. He would like to come to the council and let them know the reasoning and the purpose and what this new bill would do. It'll make it a felony, which is just a misdemeanor. He's actually meeting with the district attorney. I'd like to invite her to a council meeting as well, if there's no objection from my colleagues, just to, again, to let the public know that we are moving in every direction that we possibly can, and I think it's important for this council to support our delegation. It's actually the delegation who is, supporting this as well, and we'll invite them also. So I know it's alarming, it's outrageous, and but I think it's good that your statement, Mr. Manager, let the public know it wasn't just random, and we have a strategy, and to get an update that's not going, certainly not going unnoticed, and we'll continue to be vigilant on this.
Thank you. Any further discussion? So we'll place, accept the motion responses and place them on file. Motion by Councilor Kennedy, second by Councilor Martin. All those in favor? Thank you.
Thank you. Next, we'll go into our general public hearings, seeing it as well after 7 o'clock. We have a general public hearing. It's an ordinance to amend section 222-15, excuse me, entitled Panhandling. This is the second reading. It's in City Council, an ordinance amending Code of Ordinances, City of Lowell, Massachusetts, with respect to Chapter 222 entitled Peace and Good Order by amending Section 222 entitled Panhandling in the downtown for the Lowell Historic District. This was read in council on February 10th, 2015. That was the first reading. Now open this portion of the public hearing for those who wish to speak in favor. Those who would like to speak in favor? Those in favor of this amendment to the ordinance? Seeing none, that portion of the public hearing is closed. We'll now open up this part of the public hearing for anyone who wishes to speak in opposition. Anyone wishing to speak in opposition? In opposition. Seeing none, that portion of the public hearing is closed as well. What is the wish of the council? Entertain a motion to approve by Council Martin, second by Council Samaras. On the motion, Council Mercia? No?
No.
Further discussion? There's been lengthy discussion on this. Seeing none, roll call.
Counsel Martin.
Yes.
Counsel Mercia.
Yes.
Counsel Milonazo.
Yes.
Counsel Rourke.
Yes.
Counsel Samaras.
Yes.
Counsel Belanger.
Yes.
Mayor Elliott.
Yes.
Counsel Kennedy.
Yes.
Counsel Leahy.
Yes.
9 yeas.
9 yeas, motion passes. We'll now move back to communications section of the agenda from the city manager. Next communication is a reappointment of James Wild to the Historic Board. Entertain a motion to appoint by Council Milonazo, seconded by Council Leahy. Roll call.
Counsel Martin.
Yes.
Counsel Mercia.
Yes.
Counsel Milonazo.
Yes.
Counsel Rourke.
Yes.
Counsel Samaras.
Yes.
Counsel Belanger.
Yes.
Mayor Elliott.
Yes.
Counsel Kennedy.
Yes.
Counsel Leahy.
Yes.
That's 9 yeas.
9 yeas. Next item is another communication, reappoint Richard Lockhart to the Historic Board. I'll read this communication, I should have read the other one. Dear Mayor Elliott, members of the City Council, pursuant to the authority vested in me as City Manager under Section 5A of Chapter 566 of the Acts of 1983, I have reappointed the following person to the Lowell Historic Board, Richard Lockhart, 91 Beacon Street. 2-year term expiring February 28th, 2017. Questions?
Move approval.
Move approval by Council Mercia, seconded by Council Samaras. Roll call.
Counsel Martin.
Yes.
Counsel Mercia.
Yes.
Counsel Milonazo.
Yes.
Counsel Rourke.
Yes.
Counsel Samaras.
Yes.
Counsel Belanger.
Yes.
Mayor Elliott.
Yes.
Counsel Kennedy.
Yes.
Counsel Leahy.
Yes.
That's 9 yeas.
9 yeas, motion carries. Moving on to the next section of the agenda, we go to reports. We have a subcommittee report. We have the Audit and Clerk Oversight Subcommittee, March 3rd, 2015. Chair recognizes Chairman Kennedy.
Thank you, Mr. Mayor. The subcommittee met this evening and had a brief discussion, at the end of that discussion, and the purpose of meeting with the reason the subcommittee met was to consider the current salary for the city clerk. And after a brief discussion, the subcommittee decided to seek more information, and so the subcommittee will meet again in a couple of weeks after it has that information. Specifically, the subcommittee is looking for a survey of what other city clerks and other municipalities make, and also the subcommittee is looking for, well, that's basically it.
Thank you, Council. Further discussion on that subcommittee report? Okay, entertain a motion to accept the report as a report of progress and place on file by Council Kennedy, seconded by Council Belanger. All those in favor signify by saying aye. Any opposed? The report is accepted as a report of progress and placed on file. Next section of the agenda, we have claims. We have 2 property claims. Entertain a motion to refer to the Law Department by Council Rourke, seconded by Council Samaras. All those in favor signify by saying aye, and the opposed. Those 2 claims are being sent to the Law Department. We also have a miscellaneous petition from Leo Sheridan, care of Susie Trust, request city abandon/convey 30 Glenwood Street to adjacent abutters. Entertain, Councilor Mercia?
Thank you, Mr. Mayor. Through you to the city manager or the city solicitor. Would 30 Glenwood Street, would that be a buildable lot that they're talking about, or?
From the, thank you, through you, Mr. Mayor. From the preliminary plan that was submitted along with this petition, it doesn't appear to be, but we are going to do the research and whether this is in the best interest of the city to do.
Okay, thank you.
Entertain a motion to refer to the Law Department for a report and recommendation by Council Martin, seconded by Council Leahy. All those in favor signify by saying aye. Any opposed? That motion passes as well. We have another miscellaneous petition from Yu Zhu from Mandarin Asian Bistro. She's requesting approval to install an overhanging sign at 24 Market Street. Entertain a motion to refer the law department by Council Kennedy, seconded by Council Belanger. All those in favor signify by saying aye, and the opposed, that motion passes as well. Last miscellaneous petition of the evening is from Louis De Los Santos, request appeal and reimbursement for towing. Make sure there's nobody here registered to speak, right?
No, I don't, the petition, I don't see the petitioner here either.
Petitioners here? No? So I again entertain a motion to refer this to the law department for report and recommendation by Council Mercia, seconded by Council Milonazo. All those in favor signify by saying aye, and the opposed, that motion passes as well. We have a petition from Comcast Southern New England, request installation of a 3-inch underground conduit at 202 Chelmsford Street. Motion to refer this to a public hearing on March 24th by Council Samaras, seconded by Council O'Rourke. All those in favor signify by saying aye, and the opposed, that motion carries as well. Now move into the City Council motion section of the agenda. First motion of the evening by Councilor Mercia, request City Manager find ways and means of providing glass cases to display present and previous mayor's items that can be placed in the mayor's reception room so that the public can view gifts given to each mayor. Second by Council Milonazo. Councilor Mercia?
Thank you, Mr. Mayor. Over the years, those of us who were mayors and been fortunate enough to have been mayors have received beautiful gifts from visiting dignitaries. When I left the position as mayor, I had the privilege to bring these beautiful gifts home. I gave them all a place of honor in my home, rather than just putting them aside in the closet, never to be seen again. That's why it looks like there's so much clutter in my house. But I would like to share these beautiful gifts with the public in a room at City Hall that is known as the Mayor's Reception Room, and add more meaning to that grand room. I think the public would like to see what we have. I'm not saying you have to do it, but I'm saying that I would like to share all the beauty with the public. Thank you.
I think it's a great motion, Councilor Mercia. You and I have spoken about this, and I think we should move forward. I mean, just in Cambodia, we have got so many beautiful gifts that belong, I think, to the people, and to display them in the mayor's reception room is, I think, would be a wonderful idea. Mr. Manager, on the motion.
This is probably the quickest response to a motion in the history of city government, but they're being delivered tomorrow.
Cut it out.
Oh, yeah. Through the cooperation of the mayor's office and the manager's office, we've already purchased 2 display cases, and they will be here tomorrow.
So I would hope I would be saved one. Thank you.
The council, on that 26-hour flight, I was listening to you, contrary to what you may think. I was listening, and we spoke of this, and we did work with the manager's office, and they will be delivered, and we'll be able to, so pack those up, and we'll be able to
Thank you so
display
much.
them soon. Further discussion on this motion? All those in favor signify by saying aye, and the opposed, the motion carries. Next motion of the evening, we have a motion by Councilor Mercia. Request Parks and Recreation Subcommittee convene a meeting to discuss the naming of a park in the Hamilton Canal District that is referred as Point Park. Second by Councilor Rourke. Councilor Mercia?
Thank you, Mr. Mayor. This motion was prompted by a letter I received from you, Mr. Manager, making me aware of a piece of land in the Hamilton Canal District. A small portion of the land within the Hamilton Canal District will have great input from the art community, and a sculpture will sit on this land. Through the cultural organization of Lowell, they received a request from Newell Fletcher of the Parker Foundation to reconsider renaming the park in which the sculpture will sit. Currently, this park is referred to as Point Park. Mr. Flathers. Mr. Flathers had suggested that such an impactful space should have a name that is something more than a description. If this is the wish of the people donating money for a sculpture and they have legitimate concerns with the name of the park, which just indicates a direction, then I would like to schedule a meeting with the Parks and Recreation Subcommittee to further discuss this topic. And I did speak to my two members of the Parks and Recreation Subcommittee, which is Dan Leahy, Councilor Dan Leahy, Councilor John Leahy, and we did schedule a Parks and Recreation Subcommittee meeting for Tuesday, March 17th at 5:30. I know it's a very bad day for, I won't say it, no, please, dear God, don't make me say it, but anyway, so I think that that's a good thing. So through you, Mr. Mayor, to the city manager, if you know people that are interested as well, then I would like them to be involved, like Susan Halter from the office of, the cool organization of Lowell. So if people want to come, that'd be good, that you know of people that I don't know that are interested, please let me know and we'll schedule them through the city clerk to be there. Thank you.
Thank you, Counselor. Further discussion on this motion? All those in favor signify by saying aye. Any opposed? Motion carries. Next motion of the evening by Council Belanger and Council O'Rourke. Request city manager work with the Division of Planning and Development on a comprehensive marketing plan to promote Lowell Week to assist Lowell businesses due to the sluggish winter economy. No second necessary. Who would like to go first, gentlemen? Council Belanger.
Thank you, Mr. Mayor. This also stems from, and even Councilor Milanazzo had alluded to this, if there would be insurance, anything to make up for the loss of businesses who have suffered greatly over this winter, and it being, in the trenches as well, these last 6 to 8 weeks of this winter, it has been horrendous. There are several businesses, not only in the downtown, but citywide, that are down a dramatic percentage. I'm talking in the 60-70% range for an extended period of time. And that takes a toll, ladies and gentlemen. I think that's quite obvious. So, although the city did all we could, I think we kept best up with with plowing and snow removal as best as we could. But it was insurmountable, just the amount of snow in the short term that it all happened. But that I don't want to say there's almost nothing we can do. There's always something. So what Councilor Rourke and I had a discussion with some business owners and whatnot that maybe might be a good idea to have a Lowell Week to come down and support businesses, shop local type campaign. And I also got some emails and other literature, and the Convention Visitors Bureau is planning somewhat the same thing, so maybe we can partner up with them. But, let's try and help to the best of our ability, and this might be something that gives, merchants a little shot in the arm after what they've all been through during these winter months. So thank you very much, Mr. Mayor.
Thank you, Councilor. Councilor Rourke.
Thank you, Mr. Mayor. To piggyback on Councilor Belanger's comments, I think it's a good promotional opportunity for the city administration, the DPD, the CVB, and Lowell businesses. Hopefully the administration put their heads together and come up with a promotional opportunity. I think it's a good idea. I know at some local communities, they closing down the downtown, inviting the whole city's businesses to the area to be able to promote what they do, what they provide, and what their services are. So I think it's a good idea, and hopefully something that can be done maybe for the springtime. Thank you.
Thank you. Further discussion on this motion? All those in favor signify by saying aye. Any opposed? That motion passes as well. Next motion of the evening by Councilor Belanger and Councilor Samaras. Request city manager organize a festival to take place in April along Couple Squares corridor to celebrate Cambodian New Year. No second necessary. Councilor Samaras.
Thank you, Mayor Elliott. As you know, several groups within the Cambodian community have celebrations for their New Year. This is a new group of Cambodian businessmen in the Couple Square area who would like to do the same. And I'm just asking the city manager if he could provide the services of Mr. Marchand to help them understand the permitting and what's necessary to do this. I think anything that we can do to celebrate different ethnic groups or groups, cultural groups. The more that we have, the better off the community is. And this is specific to the Couple Square area and the business community. Thank you.
Thank you, Councilor. Councilor Belanger.
Thank you very much, Mr. Mayor. Yeah, to echo Council Samaras' comments, we've been attending meetings in the Couple Square Business Corridor, where it's a newly formed business organization. And if I may say, the Asian business community is doing an absolutely tremendous job in both the Couple Square corridor and Branch Street alone. And, you know, although they're doing well, let's try and enhance the progress that's going on up there. They're really coming together up there, and you know, the month of April celebrates Cambodian New Year. There's a lot of events on the calendar, but I'd like to, you know, the manager's office to work with the business community up there to pick a weekend where, on a Saturday afternoon, they could potentially close Couple Square, have an outdoor festival for 4 or 5 hours or so on a Saturday afternoon, bring out businesses to the street, have families come down, a nice outdoor event, you know, celebrating the Cambodian New Year and all the businesses up there that are just thriving. So it's doing great, but let's see if we can enhance it even further. So thank you very much, Mr. Mayor.
Thank you, Councilor. Further discussion on that motion? Seeing none, all those in favor signify by saying aye. Any opposed? That motion carries. Next two motions of the evening are by myself, so Councilor Leahy. They will be brief.
Let's see. Next motion by Mayor Elliott, Council Belanger. Request city manager, city solicitor provide a report on zoning ordinance relative to grandfather provision for insurance for issuance of building permits for multi-family units at burned out properties, and establish procedure to review current zoning and reduce housing density. No second needed. Mayor Elliott.
Thank you. I know the motion's rather lengthy, Mr. Manager and Madam Solicitor. I really wasn't sure exactly what the language was. But this is clearly regarding the Branch Street property where we had it was actually a sale of, a yard sale, and we had the developer come looking to buy a piece of property, not even to provide parking, but just a dumpster and a loading area for the liquor store. So it just seemed that knowing that piece of property was so small with you know, so many units on it and a fairly large commercial you know, business operating on that site, and knowing how, you know, how cramped, how densely populated that area, it just seems that I'm not sure what the provision is, and I met with Planning and Development Director, and she wasn't sure either. So I wanted to get a report from the solicitor on exactly what is allowed. Can a property owner just rebuild the same structure? Parking is a major problem in that area, and there was no parking on that particular site for what was at least 9 units, 55 people living there, and a very, very, you know, busy liquor store. So it just seems that the city should, at that point, you know, the building burned to the ground, you know, review or have some ability to make that area better. And I think the residents, I think the property owners in that area would probably agree. Maybe the property owner would not want to, you know, owners want to put as many units as they can. But is there a process whereby this, you know, property owner has automatic rights to build the same structure, knowing that there was no parking on that area? So, you know, I looking for a report to say this is what the city zoning ordinance says, or the state ordinance, or the state law. Yeah, they can build if they want to, or is there a review process that we can take a look at, you know, when something like this happens? So, thank you, Mr. Vice Chair.
Council Belanger.
Thank you, Mr. Vice Chair. I agree with the sentiment of Mayor Elliott. You know, it's my understanding that with the grandfather clause, properties such as this would have up to a year to rebuild with no, as long as they pull a permit within a year, there'll be no permits necessary through zoning or planning or anything like that to rebuild to what was there and the amount of units as was there as well. But that doesn't necessarily agree that we agree with it. You know, and I understand that, you know, faulty wiring was the factor of this devastation. And I understand where the mayor is coming from. He was on site 5:30 in the morning on that dreadful day and was there all day to see this gore, this horror that took place. And you know, he does not want it repeated. And I understand fully where he's coming from. And, you know, it is a dense neighborhood. And you know, to see the small parcel, you know, and to see the same number of units go in there, I don't think would be a benefit to the neighborhood. I really don't. And we may be powerless to do anything about it. But let's look and see if we enact something for the future. But this, if it's rebuilt of the same amount of units, I think is going to really flood that neighborhood with a lot of vehicles and not make the best case scenario for the residents and businesses that are there now. So I think it's something we should take a look at. I don't think this one necessarily is a winning battle again. But, you know, let's take a look at it and see if for future purposes, what can we do to combat and to less the density in neighborhoods such as these, so, you know, something like this doesn't happen again. I mean, I understand when it's constructed, it will be up to date with code and sprinklers and whatnot, and that's all good. But still, there'll be it's going to translate to a lot of vehicles on that street, and that's not going to be beneficial as well. So, just so we could take a look at this and see what our rights are going forward. Thank you very much, Mr. Vice Chair.
Thank you. Any further discussion? All those in favor? Councilman Milonazo?
Thank you, Mr. Vice Chair. I will support the motion. I think it's a good motion to get information back. But again, I guess I would just mention to my colleagues that we did have 2 fires over on Bridge Street, one that was also, I believe it resulted in at least 1 or 2 fatalities, and they were able to rebuild based upon the current ordinance. So again, I understand the reason the mayor and Councilor Belanger want this information. I think it's good information to get, but there has been precedent before the Branch Street fire, and those were the 2 fires over on Bridge Street.
Thank you. Councilor Kennedy?
Thank you, Mr. Chairman. I have to agree that I think that we're locked in and that the landlord is entitled to rebuild with the same number of units that he had. But I also think that the city council should recall that when the matter was before us, it wasn't really that Branch Street property, nor was it the number of units that was before us. What was before us was what was going to happen to the vacant lot beside that property. And part of it was going to be used for parking for an adjacent property, and part of it was going to be used as an area to unload trucks. So I do think that, and I think that was sent back to the Division of Planning and Development, and I do think that probably the best foot forward that we can take is to make sure that that land is used totally for parking and not for the unloading of trucks. And I think that's the best we can do with that issue on Branch Street.
Thank you. Mayor Elliott, did you have anything further?
No, that's the essence of the motion, just trying to make that neighborhood a better place to live and, you know, improve living conditions. Just so I've said my piece. I do understand, and I do remember those fires, Councilman Lazo, and I think kind of should have done something then, but this area just has such density to it. But let's take a look at it. So, you know, something in the future, hopefully we can do something in this area. I think, you know, we've received at least 1 email, and I've heard people in the neighborhood saying that they'd like to see a park there. It's kind of nice not having that huge, big structure in there. We understand property owner has rights, but moving forward, what can we do so this hopefully it won't happen, but, you know, it won't happen again. I'm just hard pressed that if there were 9 units, putting 9 cars, just 9, and I think the zoning has got to be more than that. Well, where do you put 9 cars anywhere in that area? You drive by, you can't even drive down the street right now with the snow. So, it's just many multiple issues that would be solved by less units and less cars in that area. So thank you, Mr. Vice Chair, for the
Thank you.
second.
All those in favor of the motion, say aye. Motion passes. Last motion of the night by Mayor Elliott, requests Finance Subcommittee discuss recent report on overtime usage. Seconded by Councilor Belanger.
Motion speaks for itself, Mr. Vice Chair. Just would like to refer this to the, Finance Subcommittee for a discussion on knowing we're going into a tight year and even seeing the report in the, in the paper today about 9 seat cuts. I will say that we did receive good news. I got a phone call before on my way to this meeting from the Lieutenant Governor indicating that Chapter 70 and unrestricted local aid will see an increase from FY15. I'm going to hope that stays stays firm in the House and the Senate, but I think that is at least good news. But that we have to continue to look for ways and means, knowing all of the obligations that we have. So I just think it's good to have a discussion. I know that we'll be setting up a Finance Subcommittee to go over audit reports. I wasn't going to do it next Tuesday, Councilor Martin and Councilor Kennedy. So we'll go with the following week if there's nothing scheduled. So thank you. That's a motion.
Thank you. Any further discussion? All those in favor of the motion, say aye. Motion passes. Motion to adjourn by Councilor Rourke, seconded by Councilor Samaras. Thank you.